All right, let's get started. Today, we're diving into something you'll see all the time in pediatric practice in India: acute respiratory infections, or ARIs. Nailing the assessment and management of these cases is honestly one of the most important skills you can have. So let's jump right in.
So, picture this. You're in your clinic. A mother rushes in with her 3-year-old who's got a bad cough and is breathing way too fast. What do? What's your very first move? Because believe me, what you do in these next few minutes can make all of the difference. This is exactly the kind of real-world scenario we're going to unpack today.
So, first things first, the initial assessment. When a kid is struggling to breathe, there is absolutely no time to waste and definitely no time for guesswork. It's all about having a structured, systematic approach that gives you a clear picture of what's going on, and fast. And this is that system. Think of it like a clock, ticking through the essential steps. It comes from the WHO's IMNCI guidelines, which stands for Integrated Management of Neonatal and Childhood Illness. This 5-step process is a total lifesaver. You check for any major danger signs, ask about what's been happening, count the breaths, look for chest indrawing, and then, with all that info, you classify the illness. Simple, effective, and it works.
Now let's talk about counting breaths. This is so important. Fast breathing, or what we call tachypnea, is a huge sign of pneumonia. But here's the key thing you have to remember. It's all about age. For a baby under a year old, you're looking for more than 50 breaths a minute. But for a child between 1 and 5, like our little patient, that number is 40. It's such a simple thing to measure, but it's one of your most powerful diagnostic tools for sure. Okay, so we've assessed the child, but what are we actually dealing with here? What's causing this? To figure that out, we need to talk about the etiology, the invisible enemy behind these infections.
And just look at this breakdown. It's pretty surprising, right? A whopping 70 to 80% of these infections are viral. This is such a critical point because it completely changes how we think about treatment, especially with antibiotics. Yeah, we're worried about those severe bacterial cases, but the reality is the vast majority of kids with a cough and cold have a virus. And, where the infection is makes a huge difference. You've got your upper respiratory tract infections, or URTs. That's your basic common cold, usually pretty mild. But when that infection moves down into the lungs and the bronchi, it becomes a lower respiratory tract infection, an LRT. And that's pneumonia, that's bronchiolitis. That's when things can get very serious very quickly. So who are the main culprits? Here are the ones you really need to have on your radar. On the virus side, RSV is the big one, especially when it comes to causing bronchiolitis in babies. Then you have your bacteria. Streptococcus pneumoniae and Haemophilus influenzae type B, or Hib, are the 2 heavy hitters. And there's a very good reason we vaccinate against them. All right, let's zoom out for a second. That child in your clinic, they're not just one sick kid. They are part of a massive public health problem in India, and really understanding that bigger picture is what's going to take you from being a good doctor to a great one. Just take a second and look at that number. 15 to 20%. That's how many children under 5 globally die because of acute respiratory infections. It's just staggering. This isn't just a cough we're talking about. It is one of the world's leading killers of young children. So why? Why is this such a huge problem, especially here in India? Well, it's not just one thing. It's this whole complicated web of factors. You've got the child's own health, right? Things like malnutrition or not being fully vaccinated. But then you have their environment. Indoor smoke from cooking fires, living in crowded spaces, not having good access to a doctor. It all comes together to create a perfect storm. And let's circle back to our 3-year-old. You ask the mother a few more questions, and she tells you they cook with biomass fuel. Wood, maybe dung cakes. And suddenly, that environmental risk factor isn't just some abstract idea from a textbook anymore. It's real. You can almost smell the smoke that this child has been breathing in day after day, making their little lungs so much more vulnerable to infection. Okay, so we get the big picture. Now, let's bring it back to the clinic. It's time for our action plan. How do we take everything we've observed and turn it into a concrete management strategy? This table right here, this is your roadmap. It's that brilliant WHO classification system in action, and it makes things so clear. See any danger signs or chest indrawing? That's severe pneumonia. They need to be referred to a hospital urgently. Only see fast breathing? That's pneumonia. You can treat them at your clinic with antibiotics. Just a cough and nothing else? That's no pneumonia. they can go home with advice for supportive care. See how this framework just cuts through the confusion? It's clear, it's safe, and it's incredibly effective. And these are those general danger signs we keep talking about. You need to burn these into your memory. These are the absolute non-negotiable red flags. If a child has any one of these, alarm bells should be ringing in your head. It means they need to be in a hospital right away, period. Look, treating sick kids is obviously what we do, and it's vital. But the real win, the ultimate goal, it's to stop them from getting sick in the first place. And that brings us to our last and honestly most important section, prevention. So our first line of defense is primary prevention. This is where we can have a massive impact. Immunization is huge, and it's fantastic that the PCV and Hib vaccines are part of our universal immunization program here in India. But it doesn't stop there. Things like promoting exclusive breastfeeding, pushing for cleaner cooking fuels, and teaching simple things like hand washing. These are incredibly powerful, life-saving tools. And then there's secondary prevention, which is all about catching the disease early before it gets bad. And in India, our ASHA workers are the heroes of this story. They are the absolute backbone of our community health system. They're trained to go into homes, spot those danger signs we talked about, and make sure that child gets help fast. The work they do prevents so many mild cases from turning into severe ones. It's incredible. And that really brings us to the final question I want to leave you with. As a doctor, your job doesn't end when that patient walks out your door. Okay, so you've treated one child. Now what? The real question is, how are you going to take what you know and use it to protect the entire community? Because that is the future of medicine.